respected dignitaries on the dais, off the dais. The topic for my talk is insomnia and anorexia. First of all, I want to start by saying you what is the Unani system of medicine, some introduction. It is based on the principles of Hippocrates, the humoral theory given by him. In this, temperament or mizaj plays a very important role, which classifies human beings into 4 qualitative types. That is hot and dry, hot and wet, and cold and dry. There are different characters which are found in persons of different temperament. So the disease is caused by imbalance in temperament, imbalance in humors, disorganization and discontinuity of structures. And for that, we have to reverse the abnormal temperament to normal by using drugs or diets of opposite temperament to cure the disease. So this is the assessment of temperament, that is mizaj. We have 10 parameters on which we can have this complexion, build, touch, hair, movement, diet, weather, sleep, pulse and emotions. So according to Unani concept, what is the concept of disease? For existence of human body and maintenance of health, 7 things required, that is elements, humors, organs, nima, powers and functions. And there are 6 essential causes which influence the human body to preserve the health. It is atmospheric air, foods and drinks, physical movement and repose, psychic movement and repose, sleep and wakefulness, evacuation and retention. Any imbalance in between above factors is likely to cause the disease. So this is the basic concept. So let's move towards first insomnia. It is the Latin root word which means no sleep. It is the inability to sleep, that is total lack of sleep. It is associated with an increased risk of depression, anxiety, substance use, suicide, possible immune dysfunction. So first of all, for treatment, we should know what is the etiology for that disease. For that, we have to know the etiology, that is causes. So according to causes, you can treat the disease. So what are the causes? It is voluntary causes which are under our control, like busy schedule, low intake of diet. What it does? It dries the brain and result in insomnia. Another word for insomnia is sahar in Unani system of medicine. Excessive intake of diet which produces heaviness in the stomach and produces sahar, insomnia. Excessive use of hot and dry foods material lead to formation of hot and dry humors and insomnia results. Another is temporary causes which are temporary, like deep thinking, fear, happiness, stress, depression, sadness, emotions. And there are some causes because of diseases. Like according to our system, it is abnormal simple dry temperament of brain, abnormal simple hot temperament of brain, and abnormal black bile and yellow bile and morbid phlegm. Fever, pain, indigestion are the other etiology of sahar. Avicenna, a great Unani physician, said, the normal sleep which is caused by wetness or moistness, that is rutubat wa burudat, that is coldness in our brains. I would repeat, normal sleep is caused by moistness or wetness and coldness in our brains. If wakefulness predominates, it creates dryness and weakness in the brain, which ultimately causes insomnia and disorientation. So symptoms are, if the cause is simple dry temperament, then there is lightness in the head and sensation, dryness of eyes, tongue, nostrils, but not feeling of hotness in the head. If simple hot dry temperament of brain is the cause, then lightness in the head and sensation, dryness of eyes, tongue, nostrils, feeling of hotness, burning sensation in the head, and thirst occurs. If abnormal phlegm is the cause, then we have symptoms like wetness of nostrils, eye discharge, heaviness in the head, and sleeplessness. So according to Unani etiology, it is dryness and hotness of organs, mainly brain, which leads to dissolution of normal humors of body and formation of abnormal humors like morbid phalgum, bilious and melancholic humor. So for diagnosis, if the patient is complaining of trouble falling asleep, trouble staying asleep, or early morning awakening and resultant daytime dysfunction, which can be fatigue, malaise, impairment in attention, concentration or memory, impaired social, family or occupational or academic performance, mood disturbance, irritability, sleepiness. So what should be the goals of management of insomnia? The first is to improve the quality and quantity of sleep. Second one, to reduce the distress and anxiety, to improve the daytime functioning. So how we should approach to the management of insomnia? There are non-pharmacological treatment, pharmacological treatment, cognitive behavioral therapy, sleep hygiene education. There are relaxation therapy, stimulus control therapy, that is to strengthen the association between bed and bedroom. Sleep restriction therapy means whenever the patient have got very sleepy, at that time only the patient should go to the bed, unless and until no go to bed. So it will increase the importance of bed and it will increase the sleep things. Sleep restriction therapy, licensed prescription drugs, over-the-counter medications and herbal therapy, hypnotic medications. So what should be the usul-e-ilaj, that is line of treatment? The most important is remove the cause, sabab ka izala kare. Tankiya thota, that is cleansing of abnormal black bile, cleansing of abnormal yellow bile, cleansing of saline phalgum, moistening of body and brain, moderation of abnormal temperament, and improve the digestion. Then we have pharmacological therapy and ilaj with tadbir, that is regimenal therapy. In Unani system, the treatment is based on correction of temperament, correction of dryness of brain by following three modalities: pharmacotherapy, dietotherapy, regimenal therapy. In pharmacotherapy, we have various drugs, oral or topical. These are some of the drugs, that is banafsha, kishnizi, tukme-khashkash, nilofer, babuna. For systemic or oral compounds, we have sharbate khashkash, khamira khashkash, sharbate banafsha, sharbate kahu, khamira banafsha, and itrifal kishnizi. We have topical application compounds like rogane labube saba, rogane kaddu, rogane kahu, rogane badam shiri, rogane kinnab, rogane banafsha, kurse musallas. We have dietotherapy. The soft and easily digestible foods should be there. Use cold and moist diet. Take diet 4 to 5 hours before sleep. Avoid the intake of foods which have saudavi matta, that is morbid yellow and bile, black bile. So what are the interventional therapies? We have regimenal therapies like nutul, irrigation, exercise, riyazat, aromatherapy, lakhlaka, nasal drops, swat, foot bath and massage. So this is nutul therapy. It's pouring or dripping of medicated oils, liquids, water onto targeted body parts. It is performed from a height for a specific duration. Provide therapeutic effect. It enhances the local absorption of medications and promote the removal of morbid materials. Ibn Sina states it is very important if you do with the Rogane Nilofer with Babuna. The primary objectives is to disperse the morbid matter, to modify the temperament of affected organs, and to relieve the pain and enhance the blood circulation. It's effective in treating insomnia. The physiological effect, it increases in local temperature, which elevates the blood circulation and helps to dissolve the pathological material. We have medications. Next is nasal drops, saud. It is medications which are dropped into the nose. We have oiling. Applying oil over the part of the body is termed as tadheen oiling. We have hammam. It is a kind of bathing where users can freely perspire in 3 rooms that are gradually heated up. The first room is of cold wet, second is hot and wet, third is hot and dry room. So dalak, that is therapeutic massage on the affected region, is rubbed with hands with medicated oils with a variety of techniques which results in physiological and psychological therapeutic effects on the body in disease condition. We have therapeutic massage with rogniyat. We have exercise, which is a voluntary movement for the purpose of evacuation of waste material. We have tila, that is liniments with kurse musallas, kurse zafran and gule banafsha. Next is zimat, we have poultice. It is a semi-solid preparation which is applied externally. Next we have lakhlaka, that is inhalation of vapor arising from fragrant drugs. It is an aromatic based preparation of watery or solid drugs which is kept in a wide mouthed container and allowed to be inhaled through nose. We have inhalation, that is shamoom, drug that is sniffed and its volatile contents reach to the nose. We have katur, drops, pouring drop by drop watery or oily medicine into the nose. We have nushuk, that is liquid snuff. We have pashoya, that is foot bath. Immersing of foot in the medicated decoction is called as pashoya. So we have concluding remarks about seher insomnia. Unani system is based on Hippocratic doctrine of 4 humors, dam, balgam, safra, sauda, each with temperamental qualities. Diseases are primarily caused by qualitative or quantitative abnormalities in the humors. To treat such morbid humors, it should be evacuated from the body or diverted from the affected part of the rest of the body to restore the humoral equilibrium. This treatment phenomena is achieved through the use of various Unani modalities. Next, talk about the anorexia. It is the digestive system disorder, mostly occurs in the advanced age. It is characterized by absence of hunger. The cause would be of acute or chronic diseases, or it is most common is cancer during chemotherapy. It has 3 components, that is hunger. It is the sensation that stimulates the consumption of food. Satiation is the sense of fullness during eating that leads to meal termination. And satiety is fullness that exists between the eating occasions. When a person lacks the urge to eat and his daily food intake, it is extremely decreased. It is termed as anorexia. It leads to nutritional deficiency, immunocompromised patients and susceptible to infections, frailty. These are the symptoms: belching, burping, burning sensation in epigastrium, excessive thirst. According to appearance time, it is more prominence after eating the food, as digestive system is unable to properly digest the food. So the causes of zofe ishtiha, the Unani terminology for is zofe ishtiha. The impaired hot temperament. In this, cardiac end of the stomach becomes weak, so there is loss of contractile power. Next is sue mizaj barid, that is impaired cold temperament, which causes the canine appetite. Third one is accumulation of safra, that is bile and saline phalgum, accumulation of viscid phalgum, mephitic phalgum and raw humors. Zofe meda, that is weakness of stomach. So what would be the line of treatment for zofe ishtiha, anorexia? You should address the root cause and restoring the balance. Lifestyle change and food intake modification. The dietotherapy using a diet with qualities opposite to the prevailing conditions. Pharmacotherapy by compound formulations to strengthen the digestive system. You should address the imbalance in temperament with appropriate foods and medicines. To normalize the gastric temperament, to evacuate the morbid material, to tone up the stomach, to tone up the liver, and to remove the causative factors. So in pharmacotherapy, we have oral administration of powder of nanha, that is Stichotis ajwain, oral administration of decoction of absinthe, Artemisia absinthinum, oral administration of powder of karanfal, oral administration of powder of nanha. We have compound drugs like Javarishe Ude Tursh, Javarishe Zarishk, Javarishe Anarain, Javarishe Amla, Javarishe Kamuni, Javarishe Falafil, Murabbai Zanjabil, Murabbai Halila, Shirai Badiyan, Shirai Zarish, Safufe Nana, that is Pudina plus Namak, Nuskhe, Habbe Kibrit, Habbe Hiltit, Javarishe Anarain, Javarishe Amla, Javarishe Kamuni, Majune Nanfa. We have regimenal therapies like emesis, purgation, diaphoresis, massage and moderate exercise. So it is a condition, anorexia is a condition in which the desire for food or appetite decreases. It is caused by hararat-e-haat, that is intense heat, excessive cold, morbid temperament, bilious humor, khilt-e-male, that is salty humor, and putrid humor, excess of fluid in the body, and decreased catabolism, hepatic debility, and decreased sensitivity of cardiac and of stomach. It is characterized by decreased desire for food. There will be burnt blenching when the cause is hararat-e-haat, irritation and abdominal distension when the cause is balgam-e-lazij. Next is anorexia nervosa, which is most important cause in young women. It is the eating disorders with following characteristics: immoderated food restriction, irrational fear of gaining weight, a distorted body self-perception. It is nothing but fear of gaining weight, and people leads to restrict the amount of consumption of food. Anorexia is lack of appetite, and in anorexia nervosa, appetite is not lost. It is mostly seen in the child who lives in the families under severe family conflict. Reduced parenting time can cause increased feeling of depression, family distress and impairment, parental over-control, strict parents with high expectations, childhood deprivation, low self-esteem, low self-confidence, perfectionism, obsessionality. So it creates a negative impact, psychosocial impact, impairment of social functioning. Here in anorexia nervosa, there is concept of self-attribution beliefs. That is, patient should be able to control the development of their disorder. At the same time, patient is responsible for the development and maintenance of the disorder. So for this, we have to look for circadian rhythm. We have to look for circadian rhythm, that is the biological clock. So the early rise and early sleep that makes you healthy, wealthy and wise. Why circadian rhythm is important? Circadian rhythm is very important because as soon as the sun sets, the melatonin will be released from the pineal gland and the core body temperature would be reduced and the patient go to sleep. The melatonin creates very important point in sleep. So we have to have patients. We should do according to circadian rhythm. We should do the treatments and we should do the things to the patients. Thank you.